Effexor is an antidepressant belonging to a group of drugs called selective serotonin and norepinephrine reuptake inhibitors. Active ingredient venlafaxine. Venlafaxine affects chemicals in the brain that may be unbalanced in people with depression. Venlafaxine is known as a serotonin norepinephrine reuptake inhibitor. It works by helping to restore the balance of certain natural substances, serotonin and norepinephrine, in the brain. Indications. Effexor is a prescription medicine used in adults to treat major depressive disorder, generalized anxiety disorder, social anxiety disorder, and panic disorder. How to use. Take Effexor exactly as prescribed by a doctor. Follow directions on a prescription label and read all medication guides or instruction sheets. Take Effexor with food at the same time each day. Tell a doctor if you have any changes in sexual function, such as loss of interest in sex, trouble having an orgasm, or main problems with erections and ejaculation. Some sexual problems can be treated. Do not stop using Effexor suddenly, or you could have unpleasant symptoms such as agitation, confusion, tingling, or electric shock feelings. Ask a doctor how to safely stop using this medicine. Usual dose for depression, extended release. Initial dose 75 mg orally once a day. Maintenance dose 75 to 225 mg orally once a day. Maximum dose, moderately depressed outpatients, 225 mg per day, severely depressed inpatients, 375 mg per day. Usual dose for generalized anxiety disorder, extended release. Initial dose 75 mg orally once a day. Maintenance dose 75 to 225 mg orally once a day. Maximum dose 225 mg per day. Usual dose for social anxiety disorder, extended release 75 mg orally once a day. Usual dose for panic disorder, extended release. Initial dose 37.5 mg orally once a day for 7 days, then 75 mg orally once a day thereafter. Maintenance dose 75 to 225 mg orally once a day. Maximum dose 225 mg per day. Before taking this medicine, you should not take Effexor if you are allergic to venlafaxine or desvenlafaxine, or if you have uncontrolled narrow angle glaucoma. Tell a doctor if you also take stimulant medicine, opioid medicine, herbal products, or medicine for depression, mental illness, Parkinson's disease, migraine headaches, serious infections, or prevention of nausea and vomiting. An interaction with Effexor could cause a serious condition called serotonin syndrome. Effexor is not approved for use by anyone younger than 18 years old. Taking this medicine during pregnancy could harm the baby, but stopping the medicine may not be safe for you. Do not start or stop Effexor without asking a doctor. Warnings: you should not take Effexor if you have uncontrolled narrow angle glaucoma, or if you are being treated with methylene blue injection. Do not use Effexor within 7 days before 14 days after you have used a monoamine oxidase inhibitor. Do not drink alcohol. Ask a doctor before taking a non-steroidal anti-inflammatory drug such as aspirin, ibuprofen, naproxen, Advil, Aleve, Motrin, and others. Using an NSAID with Effexor may cause you a bruise or bleed easily. If you're driving or has this activity, until know how Effexor will affect you. Your actions can be bad. Effexor side effects. Get emergency medical help if you have signs of an allergic reaction to Effexor, skin rash or hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Report any new or worsening symptoms to a doctor, such as mood or behavior changes, anxiety, panic attack, trouble sleeping, or if you feel impulsive, irritable, agitated, hostile, aggressive, restless, hyperactivity, mentally or physically, more depressed, or have thoughts about suicide or hurting yourself. Call a doctor at once if you have blurred vision, eye pain or redness, seeing halos around lights, cough, chest tightness, trouble breathing, seizure, convulsions, unusual bleeding, nosebleeds, bleeding gums, abnormal vaginal bleeding, any bleeding that will not stop, low blood sodium, headache, confusion, problems with thinking or memory, weakness, feeling unsteady, or severe nervous system reaction, very stiff rigid muscle, high fever, sweating, confusion, fast or uneven heartbeats, tremors, feeling like you might pass out. Seek medical attention right away if you have symptoms of serotonin syndrome such as agitation, hallucinations, fever, sweating, shivering, fast heart rate, muscle stiffness, twitching, loss of coordination, nausea, vomiting, or diarrhea.